Okay. Welcome everyone joining us for this presentation this evening. Today we'll be looking at something that is that will be very revealing, something that is going to help us to understand our treatment pathway. Okay, my name is Onovo Victory and I'm your kidney health coach. I wrote a book late last year, okay, late last year and early this year. And the title of the book is The Kidney Stone Handbook: 100 Essential Questions and Answers on Kidney Stones. Okay, so in this particular teaching today, I will be looking at some key questions, some questions that were asked in this book, and I will also throw more light on them so that it's actually going to help us. So I'm also encouraging everybody watching. Okay, I can see people joining the group already. Um, Ayodeji, I'm fine. It's a long time, doctor. I'm fine. Everything is okay. So I'll be going to walk us through some questions and the answers in this book. So I'll also be urging every one of us to get this book if you've not gotten the book. So this book is actually dedicated to my lovely wife, Eninye Fidos Onogo. Okay, so and in the acknowledgement, I happen to acknowledge my friend, Engineer Nnamdi Ofo. Engineer Nnamdi Ofo was the one who drove me around when I had the fracture. Okay, so and everything about the book. So in this book we addressed 100 questions, 100 different questions that people who have kidney stones ask. So now, based on popular demand, we'll be looking at these questions from question 100 back. So that is why we actually want you to be involved in this journey. It's the ebook, okay? It has ebook and it also has the hard copy format. So I'll actually advise everybody listening, everybody watching this video this evening to actually get the the hard copy. Okay, it's going to be easy for you to follow up as we go through this. So now we're looking at the first question. The first question says, is alcohol safe for a patient with kidney stones? Okay, is alcohol actually safe for a patient with kidney stones? So kidney stone patient has to avoid a lot of things. Okay, so many of those things are the things that this person is actually used to before the person became sick. So now in this question, someone asked me this question in one of my outings, and I felt that it is actually very proper for us to bring it here. So if you have kidney stone, is it okay for you to be drinking alcohol? Okay, that's a nice question. So in order to answer this question, actually want to establish that alcohol on its own is actually a diuretics. Diuretics means that taking alcohol will actually make you to pass more urine. Okay, that means you're going to urinate more. So now let's look at the answer here. Alcohol can be problematic for people who have kidney stones. It can be very problematic, causing a lot of issues for them. So one of the issues it's going to be causing is that it's going to be causing dehydration. So dehydration happens when someone doesn't have enough water in their system. So when the person doesn't have enough water, it can cause a lot of other health challenges. It can cause cramps. It can cause a lot of things that will be seen as we go. So alcohol is actually a diuretic which increases urine production and leads to dehydration. So if you are someone who has kidney stone and you keep taking alcohol, one thing that alcohol is going to do is going to make you to urinate more, and by the time you're urinating more, you're losing excess fluid, and losing excess fluid, you'll be passing urine that is highly concentrated, and passing highly concentrated urine would further endanger your kidneys and also increase the risk of the stone you're having becoming big, and also make the stone that you're having multiply. Okay, this is a risk. Actually a key difference or a key marker between those who have stones, who have repeated recurring stones, and those who find it difficult handling the present kidney stones they have. So if you have kidney stone and you're drinking alcohol, you're actually increasing what? Your problem. So it means that you have dehydration, and this particular stone you are having might actually increase in number. Okay, and if you have actually treated kidney stone and this kidney stone has actually gone, and you engage in drinking alcohol, okay, there's every likelihood that the stone that have passed can actually do what? Come back. So it's actually very important that we mind what we take during the course of this illness. So dehydration can actually concentrate urine mineral can actually concentrate minerals in the urine, making them more likely to form stones. So alcohol can actually increase your risk of having kidney stones. So it's actually very proper for us to do what? To stay away from alcohol. Okay, alcohol also increases the risk of stone formation. Some studies suggest that the moderate or to heavy alcohol consumption may increase your risk of getting kidney stone. So for those of us who drink alcohol, I think this is actually a pointer that we should do what? Remove our hands from what? Alcohol. So alcohol actually also interferes with kidney stone treatment. Okay, so if you're treating kidney stone, it is actually very, very important for you to stay away from alcohol. Okay, in fact, there's a recent study that have actually shown that alcohol has little or no benefit to health, that alcohol is actually disastrous. And for someone who is battling with kidney stone, alcohol is even more dangerous for this person because it's actually going to interfere with the treatment of the person. So if a lot of persons have been taking drugs, have been taking this, have taken that, and it's not working. The reason why it's not working is because you've been living some lifestyle that actually favors the continuous presence of kidney stone in your system. So if you have kidney stone, it's actually very, very important that you shun alcohol, okay, and shun a whole lot of other things. The reason why I'm just trying to make sure that we stick to the questions in our our area of concentration today. If not, there are a lot of things I would have actually wanted to say about the things we consume while we are treating kidney stones. So if you have kidney stones and you want the stone that you have to actually go, you need to um, follow these instructions that you're going to be giving. And part of the instructions that we're giving is that you should stay away from alcohol. Okay, and that being said, we also see that alcohol interacts with the medications that we use in treating kidney stone, such as the pain medications and even some antibiotics. Yes, even some antibiotics used in the treatment. So taking excessive alcohol can also cause what we call strain on the kidneys. It can also put more burdens on the kidneys, and it can also, by putting more burdens on the kidney, it can actually make the person become prone to developing more um, for the complications of kidney stones to become more severe. Okay, so limiting alcohol intake is very, very important. Okay, and by the time you limit alcohol intake, it's actually very proper that you also augment with taking a lot of water, a lot of water. Okay, this what the question we just answered, that's the number one question in this series so far, is alcohol safe for kidney um, stone patients? So with what we've said so far, you believe with me that alcohol is not safe for kidney stone patients. So if you have kidney stone, stay away from what? Alcohol. So that being said, we now go over to question number two. Our question number two in the book is actually question number 99. So we start from question number 100. You can see question number 100. So we now go to question number 99. Question number 99. If you have the book, can you say hi? Hi. Can you say hello? If you are with the book, can you say hello? Uh, okay, sorry. If you are with the book, can you say I am with the book? I am with the book. Okay. So for those who have the book, it's going to help you to understand what I'm saying the more. So we're going to be taking only three questions out of this whole book, and I intend staying online for 45 minutes. Okay. I intend staying online for 45 minutes. So you have it. So the number two question is, should I avoid milk while treating kidney stones? Hello? Is it should I avoid milk while treating kidney stones? So now let's look at what the answer said. When treating kidney stone, it is essential to consider your diet. Like I used to tell people that comes to my class, okay, and the people in my group too, that taking milk, that diet is actually a very important part of kidney stone treatment. So watching your diet is actually very important. And alcohol ruled off, okay, that's on this on. Then now the diet proper. One of the diets we're now looking at is milk. So milk can actually be a good thing and it can also be a bad thing. So you're going to look at a state of putting it in a balance. So the question says, should I avoid milk while treating kidney stone? So one thing that you also realize is that for those of us that have used no stone, while using no stone, we also advise that you can actually use milk to take no stone. So with that being said, so what do you think about the use of milk? The use of milk for patients who have kidney stones should be limited. Okay, you shouldn't take it heavily. You shouldn't take it heavily. You shouldn't take. You need to moderate whatever you're taking. Okay, you need to moderate. Take milk in what? In moderation. So, why limit milk? These are the reasons why you should limit milk. One, the calcium content. Milk is actually rich in calcium, which can contribute to formation of calcium oxalate. So this is why you should limit milk. Okay, the common um, calcium oxalate stone is actually one of the most common form of what of stones. Okay, so remember we have four types of stone. We have the uric acid stone, we have the struvite stone, we have the cystine stone, and we have the calcium stone. So the calcium stone is one of the most popular type of stones that we have. So if you're in the habit of every morning you're taking milk for breakfast and every other time within the day, you have when you're taking it more than required, you have every chance of compounding the thing you're having. You're compounding the kidney stone you're having, and you're making it more difficult to treat. And if you're doing this after passing kidney stone or after kidney stone surgery, it also means that you're going to be having what um, a comeback for the stone. So that is why we tell people like that you've passed kidney stone today doesn't mean that kidney stone would not come back. Kidney stones can actually come back if you begin to do all those things that favors its formation. And one of the things that favors its formation is consuming excess amount of alcohol. That's number one. And number two is avoid taking excessive milk. So for no stone, we advocate that half cup of milk with a no stone should go. The reason is that we have certain properties in no stones that works better with milk, and it actually helps to dissolve and to flush out kidney stones in your system. So calcium, the calcium, why should you limit milk? Milk is rich. Okay, we've talked about that. So we talk about the oxalate content of milk. I said a compound can actually combine with calcium to form stones. So should you completely avoid milk? Like I said, it's not necessary to completely avoid milk, but you need to take milk what in moderation. So don't abuse milk. So as you're taking milk in moderation, you also take a lot of what? A lot of water. Okay, so you limit calcium intake. If you have history of calcium oxalate stones, your doctor may recommend limiting your calcium intake to 500 to 600 per day. So choose low oxalate milk and opt for. Okay. This is interesting. Okay, so are you with me? Limit calcium intake and choose low oxalate milk. So you opt for milks that are low in oxalates, such as lactose free and or almond milk. So the essence of everything we are saying is to do what? Is to balance your diet. So now we actually intend spending 45 minutes, but it appears that we're going to spend less. So while we are tackling this question, if you have any other question, you can actually drop. So we'll use the remaining of the time that we have to answer those questions. So we have question number 3, which is our last question for today, and our last question for today. Okay, so the question says, what specific precautions should I take while choosing a treatment plan for kidney stones? Okay, he said, what special precautions should I take while choosing a treatment plan for kidney stones? I think this is actually very, very important. While you're choosing a treatment plan for kidney stones, it is actually very important that you put some things into consideration. And one of the things you're going to be putting into consideration is some medical conditions. So, if apart from the kidney stone you're having, do you have any other medical conditions? Okay, if you have other medical conditions like diabetes, high blood pressure, or as the case may be, you may need to tell your doctor that this is what you're having, so that they can actually take uh, special precautionary measures while you're being operated. Okay, so why choosing kidney stone treatment, you also need to note the one that is more favorable for you as a person. Okay, we need to understand that kidney stone treatment has modalities. So we have a stage where it will be, like I've always said this over and over again, we have a stage where it's going to be, and you'll be looking at you to take water, supplements, or medications. Okay, then there's this stage where it will be, and what you'll be needing will be special procedures like laser lithotripsy, um, shockwave lithotripsy, PCNL, and the likes. Okay, so and for you to choose any of these, you also need to consider the comorbidities and your health conditions. So one of the things you're going to consider, one of the things you're going to be considering is um, your health. So for someone who is already having AKI, acute kidney injury, or having a serious condition affecting the kidneys like the um, serious pyelonephritis or glomerulonephritis affecting this person may need immediate removal of kidney stones. That if the person decides to go for um, conservative management, the use of drugs, supplements, and medications, it's going to take longer for the person to pass the kidney stone or flush the kidney stone. And because the kidney is already having problem, if the person takes those medication longer, it's not like that the medication is going to cause the problem, but the stone that is there may actually compound the problem for this person. Okay, so now medical consideration, underlying medical condition. Inform your doctor about any underlying medical condition that you have, such as kidney disease, diabetes, or bleeding disorders. So you can also share your concerns. Okay, you also consider the medication. Share your medication list with your doctor, as some medications can interact with kidney stone treatment. So when you're treating kidney stone, just know that some medications that you're taking as a person can actually um, interact with your drugs, and it can actually affect you. So you need to discuss very well with your doctor, and you will find a way around the treatment. Okay, so then we have allergies. Inform your doctor about your allergy and allergies to medications or even medical materials. So this is going to help them to prepare. If you're going to be going for surgery, it's going to help them to prepare. Then I had someone who told us during our contact with him that he reacts to sulfonamide. So that is sulfur containing drugs. And one of the drugs that we actually give actually contains sulfonamide. So for such person, we ruled out sulfonamide and brought in other alternatives that could actually benefit the person. So now, how would this person know that he or she reacts to something if he doesn't have appropriate knowledge, or if he didn't pass it? That's why I actually tell people that it's actually very okay that we have a consultation section. That treatment is not about I want to buy drugs, I want to buy this, I want to buy Nostone, I want to buy this. So some people come online, and by the time you tell them that this is what you actually need, Their mind is fixed on herbal teas that they want to buy. Their mind is fixed on supplement that they want to buy. And if you're not selling supplements to them, they will like, this person, you don't know what you're doing. But the right thing is that we need to have a consultation before getting any medications to know if it's actually compatible for you and if it is safe for you. And whatever it is, the safe alternative can actually be delivered, can actually be given to you. So instead of generalizing it to everybody, okay, both Tom, Dick, and Harry, you can buy, you can buy, you can buy. Just like you see it over the internet, where people advertise for products without caring who you are. Once you have kidney stone, they feel that the medication should work for that kidney stone. So even if the medication is working for that kidney stone, what if the medication is doing more harm than what it should have done? So the truth is that you interact with your patient and know what actually is going to work for them. So you ask them what exam, what result, what investigations have you done, what and what and what. By the time you engage them in a conversation as a consultation for up to 30 minutes or even 1 hour, as the case may be, you will discover that you would have noted one thing that can actually help this person to thrive very well, that can actually help this person manage this case very well. In fact, we've seen a lot of it happen with a lot of our patients. By the time they started treatment, they did far better because they followed a treatment process. But some people will come and they'll say outright that what they want is drugs. They don't need you to do the consultation, that they already know what their problem is. They tell that I already know what my problem is, just give me no stone, that's what I just want. So by the time you give no stone and it's sometimes it lingers, or like they come back, it didn't work, because they felt to follow these things gradual, step by step. So one of the things I do is that we need to have a consultation section, and you need to get my book. You need to get this book, the Kidney Stone Handbook. In fact, you can see the topics that we've discussed today, that they are actually very, very, very important. Okay, you've seen the topic we've discussed today, they're very, very important. So we've talked about, for those joining us, we've talked about alcohol, and we said if it is safe, if alcohol is dangerous or safe for people who have kidney stone. So we've talked about that. So we've also talked about if those who have kidney stones should take milk. We've cleared that along out of the way. So now we're talking about what the precautionary measures, what special precautions should someone who has kidney stone take while choosing a treatment plan. You can see that the topics that we've talked about today only, they are actually very, very key to kidney stone management. So we have about 97 or thereabout that we've not touched. So imagine what is in that 97. So if you're here, you've not gotten this book, please, I'm urging everybody watching this video right now to get this book. We deliver nationwide. We deliver using GIG logistics. So wherever you are, you make payments, it will be delivered to you. We have a lot of them here. So we have a lot of them here. So you can book your copy. Okay, you can book your copy. Okay, so we go ahead. So that's by the way. So back to what we are talking about. So we talked about medication and allergy. We now talk about treatment options that are available. So one of the treatment options that is available for kidney stone is surgical option. Okay, consider the risk and the benefit of surgical option. So you don't just rush into surgical option because you have money. So you have to consider the benefit and the risk. Okay, imagine someone who is very old and placing that person on asking that person to do open surgery for kidney stone. It's going to be very, because the person has the money. It's going to be very dangerous for that person. So looking away from the money, we also need to understand this patient and make sure that the treatment that you're actually advising this patient to go for is what the person needs. Okay, so we have surgical options such as extracorporeal shockwave, lithotripsy. Okay, we have percutaneous lithotomy, nephrolithotomy, that's the PCNL, and we have other things that this person can do. Then we have the non-invasive options. So for the non-invasive options, we said explore non-invasive options such as alpha blockers or pain management for smaller stones. So if you have smaller stones, using medications like no stones can actually help you handle kidney stone properly. Okay, so more than half of us watching this video right now, we know about no stones, and the testimonies associated with no stones cannot be overemphasized. So if you're here, no stone will be available very soon. So do well to grab your own before it finishes. So discuss lifestyle challenges such as the dietary modifications or increased food intake to help prevent future reoccurrence. So you also need to talk about your food preference. So because when you have kidney stone, there are some food that you need to let go, and there are some food that you need to add. So there are one or two things that you need to work on. Okay, so if you're someone who doesn't like drinking a lot of like drinking water, you may need to start drinking water. Then if you're someone who has one or two issues, like you don't like eating certain food that can actually help you, so because you're having kidney stone, you need to bring yourself together to take those things and avoid those things that are actually detrimental to your health. So now we have post-treatment care. Okay, we have a follow-up appointment. Many of us don't follow up on our appointment, okay, with our doctors. So normally I tell people that for those using no stone, um, one bottle of no stone can actually work the magic. But most people will need to take it like three bottles for the whole thing to clear. So if after taking three bottles, I tell you to go for ultrasound scan and get back to me. So the reason why you're going for the ultrasound scan is for us to know if you've passed the stone without knowing or anything there like that. Then you come back, or if the stone is still there or if it's still small, then by the time you come back, we can actually discuss the way forward. So it's not something that you just do. You feel that you went for treatment and it didn't work, and the next thing you're going to be doing is like you're going to try another remedy that will work. So the thing there is that what actually works for people is when you follow a particular treatment plan conclusively, you will actually get what results. And those people who have actually followed our treatment plan to a conclusive end, a lot of them have gotten testimonies. So if you're using no stone and you're not getting anything, you can reach out to me. You may be doing something that you're not supposed to be doing. So you can give testimonies like every other person. So you will see. Then pain pain management. Discuss pain management option as treatments can cause discomfort or pain. So if you are this kind of person that usually have pain, and they are doing before the surgery or you're doing surgery, and your pain threshold is not too strong like some people's own, okay, you can actually do tell the doctor, the person taking care of you that look at what you can't tolerate pain, so that before you come out from the theater, they will actually know what they will keep for you. They will keep waiting for you. Okay, you tell them about that so that they will be prepared for eventualities. Just tell them about your fears, tell them about your concerns. Okay, they are not spirits to know that this is what you're going to be going through. So by the time you tell them what it feels like, they will know how and how best they can actually help you. So we have infection prevention. So you also take steps to prevent infections such as good hygiene and taking antibiotics as prescribed, not taking antibiotics as remembered. You get what I said? Not taking antibiotics as remembered. Take it as prescribed. So people take antibiotics as they remember. They can actually take today. They can take tomorrow. Like whenever they remember, they will leave it. In the next 10 years, they will take another one. In the next 20 years, they will take another one. So it shouldn't be like that. Take it the way your doctor have actually prescribed it for you and have asked you to take. So you're going to be taking one in the morning, one 12-hour leaders, one every 12 hours. Make sure that every 12 hours you're taking your medication, okay, because it has a way of making the medication work better. Okay, so now by considering these special options, you can actually make informed decision about your treatment plan and ensure that the best possible outcome. So this is it, this is it, this is it, this is it, this is it. So now let's, because of okay, we've talked 100, 99, 98. So for because of we have more time, let me touch 97. I think we'll end with 97. So question number 97 says, is kidney stone sexually transmitted? Okay, let me have your take. What do you think? Is kidney stone sexually transmitted? We've had a patient that actually stopped sleeping with the husband because she had kidney stones, because she felt that she's going to transfer the kidney stone to the husband during sexual intercourse. So the thing there is that kidney stone is not sexually what transmitted. So no, kidney stone is not sexually transmitted. Kidney stones are small hard mineral deposits that forms in the kidney when there is an imbalance of water, salt, and other substances in the urine. You can see that this book is highly loaded. If you've not gotten this book, just make sure you're getting it now. So we now listed some things that can actually cause kidney stone. Number one is genetics. That means it runs in families. Okay. Number two is diet. When you eat diet that is so high in animal protein, so high in sodium, sugar, it can actually increase your risk of developing kidney stones. Then we have dehydration, not drinking a lot of water. In fact, before I came on board to do this hot talk, I finished one big gallon of water in order to be able to hydrate myself properly. So we have medications, certain medical conditions. So we have medical conditions. So certain medical conditions such as kidney disease, gout, inflammatory bowel disease can actually increase your risk of developing kidney stones. So you need to watch out for these conditions and treat them as they arise. So we have kidney stones and sexual activities. Why kidney stones are not sexually transmitted? Sexual activity can sometimes exacerbate kidney stone symptoms such as pain, discomfort. It means that sex can actually make the pain more severe. So it doesn't mean it's being transmitted. So you need to know how to manage this pain so that you can actually enjoy the sexual part of your life, because it's very, very important. However, it is not a direct result of sexual transmission. So you cannot transfer kidney stones from from yourself to your partner. And your partner who has kidney stones cannot transfer the kidney stone direct to you. So if you develop kidney stone after sleeping with your partner, it doesn't mean they transferred it to you. It means that there is something either common among both of you that actually made you to develop it, or it's actually mere coincidence. Okay, so I think that is that. I want to take questions from the persons online. If you're online and you have questions on kidney health, kidney stone you want us to talk about, you can bring it on. You can ask questions about the book, or generally how you feel, or something you want us to talk about on air. You can say, take much water in the evening to do it effective to the kidney. Okay, taking a lot of water in the evening. So for me, I advise you to take a lot of water during the daytime. So morning, afternoon, take a lot of water. So once it's time for you to go to bed, I usually advise that you limit the amount of water you take, because to limit the amount of, to reduce the amount of time you wake up to go and urinate. Okay, what that is going to do is that you're going to give you more time to rest. Are going to give give your kidneys also time to rest. So you're also using it to manage stress, and also to rewind yourself so you will do better the next day. So when you take a lot of water at night, you may actually not peak when you have issues with your kidneys, or when you're having conditions like diabetes and the rest of them. So it is actually advisable you reduce the amount of water you take in the evening, and drink more in the morning and the afternoon when you are active. Okay, Mr. Ibrahim Ahmed, I don't know if I've been able to answer your question. Okay, so I don't know if there's any other person that have questions. Okay, I want to appreciate you for joining us. Those who have watched this video and those who will be watching later, I want to say a very big thank you. And this thing we've discussed here today is from the book, The Kidney Stone Handbook, 100 Essential Questions and Answers. It's available for delivery, so it just goes for, you know, the price now. I wouldn't be saying it here, because some people will be watching this video in the next 10 years, and the price may not be the same. So you can send a message to me privately, and I'll be there to answer you. So make sure you share this video to your friends and loved ones. And I want to say a very big thank you for joining. Once again, I'm Oliver Victory, your kidney health coach, and I'm dedicating this episode of Kidney Health Class live streaming video to all nurses worldwide. And as we celebrate the Nurses Week, we say, may the Lord protect the nurses and reward them for their care for all of us. In Jesus' name, amen.
Well done.
I'm not doing that.
Not to go to London.